One of the biggest issues in this whole reform thing is making sure all of the uninsured are actually covered. But is that doable? One of the many questions for our insider, chief medical correspondent and practicing neurosurgeon, Dr. Sanjay Gupta. I feel like I'm going to give you an award right here. So here's a related question. We want to get to this question right out of the gate here from Vanessa in El Paso. Listen for just a moment.
Hi, Dr. Gupta. My name is Vanessa, and I'm from El Paso, Texas. I am a mother, a working mother of two, happily married. I hate to admit, but I haven't had health insurance for about 5 years. My employer does offer their insurance, but the premiums are very high and my family cannot afford. I'm hoping that the new health reform bill passes soon. So what my question is if the president does sign this bill in October, how long would I have to wait before I can sign up for the new public plan? Thank you.
All right, Vanessa, first of all, thanks for calling in. This actually gets at, I think, a myth overall regarding how quick all this might take place. We're talking about it a lot now. People think it's going to be instantaneous. It by no means is, Heidi. You know this. This obviously is going to take a while, quite a while, I think, surprising. We try to create a timeline for people to get an idea. Okay. Again, the caveat being we don't know how this is all going to play out, but this is a potential timeline. 2011, really, before you start to see the tax increases take effect that could potentially pay for this. That's 2 years away from now. Right. 2013, a couple of things. Look at that second line first. That's when everyone is going to be required to have health insurance. That's 2013. And that pre-existing conditions covered is a big part of getting that, not discriminating based on pre-existing illnesses, but also the exchange, this idea of this public-private partnership would be open to businesses with under 10 employees.
Yeah, the co-op idea.
Well, yeah, the co-op idea I think is going to be a little bit more nuanced than that, because this is more of a federal thing, and the co-op may be more at the community level. By 2014, they may start to expand this to businesses with 20 or fewer employees. But and then after that, there may be a vote saying, can we expand this even more? Can we make more people sort of eligible for this potential public option? Again, look at the time frame there, 2014, it's 2009 now, at least 5 years away probably before you're starting to see people in these categories qualify.
Yeah, so bring it back to Vanessa, our caller from Texas who works for this company that has more than 20 employees. She then, according to that, will not have the option to join the exchange for like another 7 to 10 years.
It could be several years, at least based on what we're hearing now. And I know that's not good news for a lot of people who need help right now, but at least based on the calculations that we have. And let me add a couple more caveats to that. I don't know Vanessa's personal financial situation.
We don't know how long she's going to work there.
How long she's going to work, the size of her company, or how much her premiums would be with respect to her income. Not everyone's going to qualify for this. Your premiums have to be greater than 11% of your income, at least according to some of the initial drafts of this. And if you have access to private insurance elsewhere through your husband or through somewhere else, you may not qualify either. So there are lots of nuances here, and that's just the initial drafts of all this.
Read the bill, right? I mean, lots of fine print, lots
I spent most of my job as CNN over the past several days reading that bill, and and I can tell you, it is still complicated.
Yeah, no question. All right, our insider this morning, Dr. Sanjay Gupta. Thank you, Sanjay.